Okay, so I get this question all the time, and I'm still trying to figure out how to answer it properly. As of right now, I think the plan is to stay in Australia, but there are some reasons I'd go back to Canada. Namely, if I got into the residency program that I wanted to, then I'd go back, probably finish that, and then figure out if I wanted to come back here or not. Um, but at the same time, I would do my internship here, which is like 2 years. That's a whole other discussion about like how training works in Canada versus Australia. But I would essentially do my internship here first, get my full registration here, and then make considerations on if I want to go back home and do my residency there or if I want to do training here. So it's a bit up in the air right now. Okay, so if there's anything I've learned in my 4 years of med school so far, is that it is definitely doable. However, you have to learn how to manage things both in your personal life and like your academics and placement and all that side of things. So sometimes that means you have to figure out where your commitments are and, can you really work this part-time job versus that one while still studying. And you obviously still want to like maintain a personal life and maintain your friendships and go to fun events and do things like that. So it's definitely doable. It does require sacrifice sometimes. And in terms of just purely academics, there's been a lot of times where I've had to switch up how I'm studying or change things around or try different methods to kind of get everything to come together. But again, doable, just takes a lot of hard work sometimes. Okay, so I'm not Australian. I'm from Toronto and I've grown up there since I was about 6. And before that, I lived in Bangladesh. So I came to Australia for medical school in 2022, I think. I was supposed to start 2021, but because of COVID and the border, they just told me to defer the year. So I started in 2022 and now I'm here. So, from what I know, you have to do a few exams in order to be able to go back to Canada to practice. But if you take a look at this website, this will show you everything. Okay, so I'm just out to get lunch right now because I left my packed lunch back at the house. We went from having no patients to having all the beds full, and a lot of good learning because a lot of very complex patients come in sometimes when you're out on rural. So that's been fun. And we've got teaching later today as well. So I think that'll be what takes up most of the rest of today. And then just get home and study some more. But yeah, so far it is almost 2 and now it's lunchtime. All right, so thanks for coming along today. Hopefully you guys learned something. Hopefully I was able to answer some questions. I think it's probably like 2 a.m. in Canada right now. But if you guys have any more questions, feel free to just message me on Instagram. I'm more than happy to help. And if you have any admission-specific questions, then definitely reach out to Oztrack, as they're the ones that are best prepared to give you all of that info. And honestly, if it wasn't for them and their team, then I wouldn't have even applied to JCU or gotten in and gotten to do all the fun stuff that I get to do now. So I definitely recommend reaching out to them if going to Australia for medical school or any of the other programs is something that interests you. So yeah, again, I'll just leave my Instagram like over here somewhere. And then if you guys have any questions, just let me know.